Hello and welcome back to T1D Academy. My name is Harold and my son and I are really glad that you're here. This video focuses on something that almost immediately begins after a type 1 diabetes diagnosis. Insulin therapy. When you're brand new to this world, it can feel confusing and overwhelming. And you may have a lot of questions about what's happening and why decisions are being made so quickly. And that's what we're going to talk about today in this video. Why insulin therapy begins immediately after admittance into the hospital and diagnosis of type 1 diabetes. When someone is diagnosed with type 1 diabetes, one of the very first things that happens is that insulin is started, sometimes within minutes or hours. And if you were just admitted and you have no clue what type 1 diabetes is, which was the case with my family, but you're being told by someone in the hospital, from the hospital staff, that this substance needs to be pumped into you or your child's body, that can be pretty confusing. But there is a reason for that urgency. As we've already established in previous videos, type 1 diabetes means that the body can no longer produce enough of its own insulin. And at diagnosis, many times the individual wasn't casually sitting at home wondering what's going on, maybe watching TV and eating some chips. Often they were admitted because something was seriously wrong. In many cases, the hospital visit was triggered by what's known as DKA, diabetic ketoacidosis, or another serious imbalance within the body that required immediate medical attention. So this problem isn't theoretical, it's immediate when it's occurring to you or your loved one. Without insulin, as we've established from previous videos, blood sugar rises quickly. When that imbalance continues, the body begins breaking down fat for fuel, and that process produces ketones. If ketones build up too quickly in the bloodstream, they can lead to the condition known as diabetic ketoacidosis. We've referenced DKA several times already, and a future video will delve into this specific topic and provide more in-depth information around what this condition is. But just know that at a high level, DKA is a medical emergency. It can involve dehydration, vomiting, stomach pain, rapid breathing, confusion, and if left untreated, it can become life-threatening. So starting insulin immediately interrupts that process. It lowers blood sugar, reduces ketone production, and restores metabolic balance. That's reason number one, survival. Reason number two for why insulin therapy begins immediately is stabilization. Before diagnosis, many individuals, children, teens, adults experience intense thirst, frequent urination, weight loss, fatigue, and overall body weakness. These symptoms are the result of high blood sugar and the body not being able to properly use glucose. When insulin is started, blood sugars begin coming down. The body can use its fuel once again to create energy. Dehydration improves, and the system starts rebalancing itself. Often within days, people begin feeling physically better. Insulin isn't just preventing a crisis, it's restoring normal body function. There's also another important reason that insulin begins right away: preserving what function may still remain within the pancreas. At the time of diagnosis, the pancreas is often still producing varying amounts of insulin. It's not enough to maintain normal blood sugar levels, but it may not be zero either. When insulin therapy is started and blood sugars are brought under control, it reduces stress on those remaining insulin-producing cells within the pancreas. Sometimes this leads to a temporary phase where insulin needs decrease, commonly referred to as the honeymoon phase, which we discussed in a previous video. Starting insulin immediately may help preserve remaining pancreatic function for a period of time, and that can make early management smoother in some. Not always in everyone. And then there's the long-term picture. Research has consistently shown that early and sustained blood sugar control significantly reduces the risk of long-term complications. I sometimes refer to these as the list of opathies. Retinopathy, which affects the eyes. Neuropathy, which affects the nerves. Nephropathy, which affects the kidneys. Cardiomyopathy, which affects the heart muscle. and arteriopathy, affecting the blood vessels within the body. Some people may also develop gastroparesis, which is when nerve damage slows down how the stomach is able to empty food. All those conditions are linked to a prolonged exposure to high blood sugar levels over a significant period of time. The hospital staff isn't just reacting to the moment, they're attempting to set the baseline for decades of healthy management ahead. It's important to realize that insulin is a necessary replacement for something the body isn't producing at all, or isn't producing enough of. So if you or a loved one was just admitted and the doctors are talking about getting you or your child started on insulin as soon as possible, just know that this is a good and necessary thing. And once that insulin administration begins, you'll start seeing a huge difference in how you or your loved ones feel. So when insulin therapy begins quickly after diagnosis, it's not an overreaction. It's protection, stabilization, prevention, and also preservation. That's why it begins immediately. In future videos within the hospital stay following diagnosis series, we'll continue delving deeper into all other relevant topics touched on during the anchor video. Topics such as DKA, sick day management, bolus and basal dosing determinations, the dawn phenomenon, and all other knowledge points and skills that were introduced during those first hospital days. Each topic standing on its own and broken down clearly. Before wrapping up, and as a disclaimer, the content on the T1D Academy YouTube channel is for informational purposes only and should never be interpreted as medical advice. I am not a doctor nor a healthcare professional. Everything shared here is based on our lived experience and personal perspectives only. Please always consult a qualified medical professional for diagnosis, treatment, and individualized medical advice. Until next video, take care of yourself and take care of each other. And remember, you've got this. And as always, Liam, 143AI+1. Take care.